Hi, I'm Chloe and I'm a clinical nurse specialist.
Hi, I'm Rena, clinical nurse specialist. So approximately 2 weeks before your operation, you'll be invited to come to a surgical pre-admission clinic. You're welcome to bring a friend or family member. It is vital you attend because the information gathered at this appointment will assess the suitability for surgery and also allow us time to resolve any issues before your operation day.
When you arrive for your surgical pre-admission appointment, our admin team will check you in at the outpatient reception desk. They will confirm your details, give you a hospital wristband and a checklist of people that you will be seeing. You will go for an ECG, a chest x-ray, have your observations taken and a blood test. You will then see a pharmacist, an anaesthetist and a clinical nurse specialist who will also carry out an examination. We will also confirm your understanding of some of the subjects already covered in the cardiac surgery booklet. This will include 6 weeks driving restriction, what to pack, including a bra for female patients to be worn for a minimum of 12 weeks, good nutrition for wound healing, flexibility and strengthening exercises, your knowledge of move within the tube and self-hugging technique, what kind of invasive lines to expect when you wake up from surgery, the expectations for your recovery whilst you're on the ward, and 2 important documents such as the tissue consent form and the respect form.
If you are having heart valve surgery, it is important that you've seen a dentist for a review and had any ongoing treatment complete to avoid any delays. This is to prevent an infection called infective endocarditis. We will give you a small warning card explaining this. This information is for you and your dentist.
At your pre-admission appointment, you will see a clinical nurse specialist who will undertake a full consultation and examination. It's important that we get as much information from you as possible by carrying out risk assessments and making any referrals necessary. It's a perfect time for you to also discuss any concerns that you might have.
Hello, I'm Ben Chisnell, a consultant anaesthetist here at Royal Papworth. When you come for your pre-admission clinic appointment, you'll have a conversation with an anaesthetist. Anaesthetists are doctors who are experts in keeping you asleep during your surgery and in maintaining your body's normal functions during the operation. We are also experts in post-operative pain management and will make sure you're comfortable after your procedure. As part of your pre-admission appointment, you will discuss the following things with your anaesthetist: your past medical history and whether you've ever had any problems with an anaesthetic in the past. This will help us plan your anaesthetic accordingly. What you can do in your day-to-day life, including how far you can walk, which gives us an idea of your physical fitness for surgery. And we can also give advice on how to improve your fitness for surgery, which will be covered more in another video. Whether you have any loose teeth or any problems with your food pipe, which allows us to assess the risk of some of the procedures we need to do as part of your anaesthetic. Once we have all this information from you, we will then discuss the anaesthetic process and some of the main risks involved. These include the risk of minor damage to your lips or gums, which is about 1 in 500, and the risk of damage to your teeth, which is about 1 in 200, from the breathing tube, which we have to insert gently as part of the anaesthetic. We always take a lot of care doing this, but there is a small risk of causing damage to your teeth. There is a small risk of damaging the food pipe, which is less than 1 in 5,000, and this is approximately the same risk as having a camera test or an endoscopy for your stomach. For all surgeries, there is a risk of post-operative confusion or delirium. The risk is higher for major surgery and if you're over 65. Following heart surgery, the risk of post-operative delirium is approximately 4 to 5 out of 10. For most people, this will only last days or weeks following surgery, but in rare cases it may last longer than a few weeks, and you may have to see your GP once you've left hospital and may require further investigations. We have a leaflet on delirium awareness, which we'll give you when you come to your pre-admission clinic appointment.
Hello, I am Amir. I'm the surgical pharmacist. At the pre-assessment clinic, the pharmacist has a very important role in reviewing your medications and making sure that the correct ones are stopped at the right time prior to your procedure. First of all, we ask you a series of questions to obtain a full and accurate history from you. This will include details around your allergies or intolerance status to any medicines or non-medicinal agents. And then we move on to your prescribed medications, and this may inquire about any items that you receive from hospital clinics, any specialist injectable medications, anything that you might get from home care delivery services or clinical trials. We will also ask you about any over-the-counter preparations you may be taking, which includes herbal medicines or remedies, minerals, supplements, creams, eye drops, ear drops, nasal sprays, and so forth. We will record all of this information on our electronic system, ready for your admission, for your procedure. Now, certain medications may increase the risk of complications after surgery. This may include kidney injury, low blood pressure, bleeding, infection, and we are placed to identify those medicines and stop them at the right time to help reduce the risk of those complications arising. In preparation for your admission, we would ask you to bring a supply of all your regular medications in with you, preferably in the original packaging to allow us to identify it more easily. And also, in preparation for discharge, stock up on some over-the-counter painkillers and laxatives to have readily to access at home.
Hello, my name is Stephen. I'm one of the surgical advanced nurse practitioners here at Royal Papworth. If you have been admitted to your local hospital with new or worsening heart symptoms, your local team will be looking to establish the best care for you. This will involve discussions with both medical and surgical teams to establish the best treatment you require. If there is a need for a heart operation, this will be discussed with you locally. This will then put you on what is called an in-house urgent surgical pathway. Sometimes before this type of operation, there may be a need for additional tests or investigations. When we have these results, we will discuss them with our surgical team and look to establish an appropriate date for your operation. Please be aware that sometimes this will still mean a wait for a few weeks before the operation. This will be because of how busy we are at the hospital, which is sometimes affected by emergency operations. We do look at our waiting lists every day, and if we are able to bring the date of your operation forward, that's what we will try to do. Also, if there is a change in your clinical condition, your local team will contact us and we will look at your case. In the meantime, whilst you are waiting, your local team should be able to give you a copy of our cardiac surgery information booklet. This is also available on our public website so family and friends can look at the same information. When you do come to Royal Papworth, you will be seen by the surgical team. We will discuss your medical history, we will do a physical checkup and discuss with you what to expect during your operation, and also discuss with you your recovery afterwards.